Welcome to the Venari Podcast. My name is Joe Knight. I lead the commercial function within the life sciences and healthcare practice at Venari Partners. Today, as part of our Chief Commercial Officer series, I'm joined by Tiffany Ahlers, Chief Commercial Officer of Mycovia Pharmaceuticals. Tiffany's experience spans 25 years across biopharma and consulting, and today we're discussing her approach to building teams and planning for commercial success. Hi, Tiffany.
Hi, Joe. So good to see you. Thank you so much for having me.
So, Tiffany, perhaps we could start. You could tell us a bit about your experience to date.
Yeah, absolutely. Thank you. So as you mentioned, I have over 25 years in commercialization and biopharmaceuticals, working for startup, small and mid-sized companies. I worked across multiple therapeutic areas with a variety of biopharma companies, including Cornerstone Therapeutics, which is now Chiesi USA, Stallergenes Greer, and Cello Health Advantage, which is now Lumity. And as you mentioned, I am currently the Chief Commercial Officer for Mycovia Pharmaceuticals, a women's health company.
So tell us about how you became a Chief Commercial Officer. What are the key attributes that you took from earlier roles in your career that help inform the role that you're in now?
So my experience has been grounded in marketing, market research, data, strategy, of course, launch. And then, in roles supporting in market access and sales, and really have always wanted to evolve into really looking at the entire commercial organization and be able to build or grow a commercial team. And so I've had the pleasure now for over 4 years in my current role as Chief Commercial Officer to do just that. But I think, just having a good foundation and having experience, and even if it's not 100% your role at the time, but having experience and exposure to all areas of commercialization really helps you be successful in a chief commercial role. I don't think anyone can say that they come to this role with 100% subject matter expert in all areas of commercialization. We all have our strengths. Mine happens to be in marketing and strategy, of course. But I think we all, when we come into the role, we then learn and we build our teams, of course, to complement our strengths. And so I think that's a big learning. And I think, what companies are looking for in chief commercial officers, particularly as I think about startups and small pharma, is that they want strategists and they want a tactician both, right? And so you have to be very, very flexible. And you do have to have broad and diverse experience in commercialization, as I said. And then lastly, be willing as a commercial leader to roll up your sleeves and work side by side with your team to get the job done.
So throughout your career, you've been involved in building commercial organizations ahead of launches a number of times now, on both the consulting side and within biopharma companies, including established entities like the 100-plus-year-old Stallergenes, and then more recently at the startup Mycovia. What are the fundamental lessons that you've taken along the way from those processes?
Yeah, that's a great question. And definitely you do take a lot of lessons and use those learnings as you move along in your career. I really follow the 5 Ps: prior, planning, prevent, poor performance. And I know that's somewhat of a given, but particularly in a startup environment, you don't always have the luxury of resources and time. So you really have to be able to prioritize those activities that are going to help ensure that you have the most successful launch possible. And so things like developing your contracting strategy, identifying your key HCP and patient targets, ensuring the differentiation and positioning of your brand among your competitive set, and then developing a commercial strategy that is actionable and measurable. All those things are really important. I think also too, it's, we all learn from each other. And I can't say how much I rely on my network, my mentors, my colleagues, my peers, those that have been there and done it before me. Just recently I had the opportunity to reach out to several of individuals, commercial leaders in my network. I was preparing for a launch in a therapeutic area that I hadn't had previous experience. And the insights that they shared were invaluable. I mean, what to do, what not to do, kind of the watch outs. And so I took all of that intelligence from my network and I brought it back to my team. And that really helped us inform our strategy and our thinking. And so I would just encourage everyone to really, utilize your network experience. People love to share what they've learned with others.
Yeah, indeed. And we see that a lot here at Venari Partners. You talked there about getting the culture right for building a commercial organization and preparing a company for launch. What are the key areas to focus on here, and what differentiates a company culturally ready for commercialization from one which is not prepared?
Obviously, we're always looking for the candidates that have all the qualifications and roles, but that that culture aspect is so important. And really looking for candidates that demonstrate the core values of the organization, and in particular are aligned on with the company's mission and vision. And then developing a team that has, open and transparent communication. They have to be able to not only build those relationships within the commercial organization, but be able to work cross-functionally. And that's so vitally important to be able to have that type of transparent and communication. And it just creates a good environment as you prepare for launch. I find that companies that aren't aligned on the mission and vision, or don't have the same focus, they can struggle as they're preparing for launch. It could just be a little bit more challenging.
And timing is clearly very important as well in building out the commercial organization, getting that right. We spend a lot of time helping companies think about when to build out the commercial organization and the right time to execute that. When do you think that is in a biotech company?
Yeah, and I think it's a really good question. And so, I think depending on the situation, particularly in startups, where you're often getting ready to launch a first product, I think there's a value of bringing on at least one commercial lead earlier on in the process. So, potentially after a company finishes a successful phase 2 and they're getting ready to develop the clinical trial designs for phase 3, having that commercial perspective can really potentially help strengthen what your label may be, and obviously would increase the commercial opportunity for your brand. Additionally, I think when you think about the remaining of the commercial team, again, depending on the market and depending on the resources, you want to bring in, your marketing team, your market access account team, typically within 6 to 9 months prior to your PDUFA date.
If we take a step back now and think about kind of the broader trends in commercialization in biopharma, what do you think we'll see more of in the next year and the next decade?
Yeah, no, great question. So I think more companies are going to change how they forecast. And so really using what I call operational or bottoms up forecast at launch versus demand forecast. It gives you a lot more insight into the resources needed to fully fund your commercial organization, because you are now right-sizing your sales force to the actual potential of your brand at the beginning. So I think that's really important. And then also developing launches that are very surgical in approach, and potentially look at either a phase launch or a soft launch, so that you're really maximizing leveraging your resources, and be able to adjust appropriately. So as you see uptake, as you see formulary coverage, you can increase your marketing efforts, you can increase the size of your sales force appropriately. So a lot of times, instead of being a national launch, you may have more regional focus, where you have the best opportunities initially at launch. And then as the brand develops, and you gain prescribers, and as you develop formulary access, then you open up other geographies or other territories.
Do you have any advice to a younger version of you or aspiring executives who would like to end up being a chief commercial officer one day?
Yeah, I would say take every experience given to you. A lot of times I would take on additional responsibilities or roles, like corporate strategic initiatives, because I wanted to have that experience. And a lot of times that was broadening my knowledge base, because I got exposure to other areas of the business. And so I would just say, when those experiences are available, latch onto them, because that will really help you. And then, as I said before, you work with your mentors and your network. Those individuals can also help you, and ask them, where are areas where they would say you could go to get additional experience or knowledge. And so those are all things that I think are really valuable.
Thanks so much for joining the Venari podcast. Great to have you on our Chief Commercial Officer series.
Thank you so much. It was a pleasure.